Over the course of fertility treatment, some patients may benefit from luteal phase stimulation and egg retrieval. Here, we'll discuss luteal phase egg retrievals and how they work. There are two main phases of the menstrual cycle, the follicular phase and the luteal phase, separated by ovulation. Simply put, while most egg retrievals happen during the follicular phase, luteal phase stimulation and egg retrieval take place during the luteal phase. During the follicular phase, follicles are developing and maturing in preparation for one egg to be ovulated. The luteal phase can be thought of as the second half of the menstrual cycle, during which the corpus luteum, a temporary collection of cells, helps prepare the uterus for pregnancy. However, during the luteal phase, follicles can still develop, so stimulation during this time may lead to viable eggs for retrieval. At its core, luteal phase stimulation seeks to develop smaller follicles for possible retrieval. Thus, any patient with smaller follicles at the time of their follicular egg retrieval may benefit from a luteal phase egg retrieval as well. Your physician will help determine if luteal phase stimulation may be suitable for you. Some particular cases which may make good candidates for LPS include the following. Cases where the follicular phase included one leading follicle may offer potential for other smaller follicles to develop via LPS. Patients with polycystic ovarian syndrome may benefit from continued lower stimulation to develop additional follicles. Patients with diminished ovarian reserve often have uneven or inconsistent follicular development, which can continue through the luteal phase. Typically, patients suitable for luteal phase stimulation may be notified when preparing to trigger for their follicular phase egg retrieval. They can think it over and make their decision by the day of the follicular phase egg retrieval itself. From there will be medication and cycle monitoring, with 2 monitoring appointments being the most common. Like the follicular egg retrieval, there will be a trigger shot, typically 7 or so days after the follicular egg retrieval. Lastly, the luteal phase egg retrieval will take place, most often 9 days after the previous egg retrieval. Optimism is important in the fertility journey, but patients must also have realistic expectations. With most patients having relatively few follicles, the average number of eggs retrieved in an LPS cycle is lower. For most patients, 1 to 3 eggs will be retrieved in a luteal phase egg retrieval, though those with more follicles may still retrieve more. As such, patients who retrieve few eggs in their follicular cycles may benefit more with luteal phase stimulation when compared to those who previously have retrieved many eggs. Once an egg is retrieved, its likelihood to fertilize and reach other developmental milestones is similar to eggs retrieved in the follicular phase. However, it's important to mentally prepare yourself that any procedure carries the possibility of being unsuccessful. Life IVF offers simple and accessible package options for luteal phase stimulation patients. Our luteal phase egg retrieval package includes the cycle management for the luteal phase, either through in-office appointments or outside monitoring coordination. Next, it also includes the luteal phase egg retrieval procedure itself, as well as any laboratory work required such as culturing or cryopreservation. Since luteal medication needs can vary widely, medication will be kept separate, and patients can acquire medication at Life IVF or the pharmacy of their choice. Similar to other egg retrievals, most patients choose to avoid any form of sedation, especially since luteal phase egg retrievals tend to have fewer eggs and be shorter as a result. However, patients may select local or IV sedation at additional cost. Patients with fertility benefits are recommended to consult with their billing or patient coordinators. Depending on the circumstances, some patients may opt to pay cash rates instead of utilizing their benefits, potentially saving egg retrieval allotments for additional follicular phase egg retrievals. Given the special risks associated with luteal phase egg retrievals, Life IVF offers certain protections for patients in case the cycle is not successful. If the cycle is canceled before an egg retrieval takes place, the full amount of the luteal phase package will be refunded. If the egg retrieval takes place but fails to yield an egg, One half of the cost will be refunded, with the remaining used to cover staff and materials used for monitoring and the procedure. In any case, medication purchased from Life IVF cannot be returned or refunded. However, patients may opt to use leftover medications during additional treatment cycles. While the fertility journey can feel complex, patients can empower themselves by taking an active role in understanding their treatment. Reviewing the provided material about luteal phase egg retrieval, including the process, timeline, and results, can help reduce stress. Confirming aspects of the treatment plan, including fertilization and embryo testing, avoids unnecessary confusion and ensures a smooth process. Lastly, be sure to share any changes, questions, or ideas you may have so you can feel comfortable and confident with your treatment. We hope this presentation improved your understanding of luteal phase stimulation and egg retrieval and wish you the best on your fertility journey.